King was born 2 months early, so he was born at 7 months. He is one of 10. He's the youngest of 10 children, and we were in no way prepared for a special needs child. King has HI, which is hypoxic ischemic encephalopathy. So he was born with a brain disorder from lack of oxygen to the brain, which led to him having CP. He is definitely a fighter. To me, he's doing a lot that he isn't even supposed to do. You know, they counted him out. They gave us 5 days for him to live, and he's 2.5 years old right now. So,
Jay, good job, Jay.
The care coordinator is very vital in King's situation. They basically do all the fighting and talking for King. The things that Monica does, I wouldn't even know. I don't even know where to begin.
Monica is great. She is very vital as his coordinator. I think she bridges the gap as far as the medical terminology and knowledge and the needs. All we always want is what's best for King and his well-being. So her being very communicative and very clear and concise and very good at responding to any questions is very important.
So the benefit of care coordination is that the family will have one point of contact, so that the care coordinator gets to know the family and the circumstance very well, and vice versa. And so if there's a specific need, that advocacy can get into place where that care coordinator could work with the family to help get that approval. So today, Mr. King needs a new bed because he's outgrown his crib and he is just an absolutely handsome big boy. So we have a great equipment company, Interface Medical, and we're going to work together to look at King's room and also talk a little bit about some of King's clinical needs and look at the appropriateness at the types of beds that are available in the community.
It's basically a bed that we want to reduce the risk of harm.
The benefit of having care coordinators and physicians and practitioners very familiar with the children with complex medical disabilities enables them to take a clearer and more concise picture of what the needs really are. Caring for a child with complex medical disabilities is much different than caring for a child without complex disabilities. The needs, the requirements, both from a medical standpoint, from a nursing standpoint, from an equipment standpoint, far exceed what anyone can imagine.
I would definitely recommend medical homes to other families with children with special needs. In-home medical makes it just so much more convenient, so much easier, and it lets them know that, yes, I may be different, but I'm still a part of this family. You know, I can still be home and still interact and do other things that what we would call normal kids do. You know, I may have equipment, but that doesn't mean that I'm any different.
I think more practices should become medical homes because I think that you get a lot of satisfaction in working with families of children with disabilities, and you get to make a difference. And I think that I've been doing this for over 15 years now, and every day what brings me to work is seeing a child like King and how well he's progressed and how happy the family is and how supported they are.